Today, let's talk about polycystic ovary syndrome, or PCOS. It is one of the most common hormonal conditions out there for women, but you'd be shocked at how often it flies completely under the radar undiagnosed. So let's get right into it. So just how widespread is this? Well, up to 15% of women of reproductive age have PCOS. Think about that for a second. That's almost 1 in every 7 women. This is not some rare, obscure condition. It's a major public health issue around the globe. And here's the part that's truly staggering. The World Health Organization estimates that a whopping 70% of women who have PCOS don't even know it. That's millions and millions of people dealing with symptoms day in and day out without ever knowing the root cause. Okay, so what in the world is PCOS? Well, when you boil it all down, at its absolute core, it's a story about hormonal imbalance. So the textbook definition is that PCOS is a hormonal imbalance where the ovaries start producing too many androgens. Now, you can think of androgens as male hormones, like testosterone, and while it's totally normal for women's bodies to make a small amount, in PCOS, those levels get cranked up way too high, and that just throws the entire reproductive system out of whack. All right, let's clear up a huge misconception right away. The name polycystic is super misleading. You don't actually need to have cysts on your ovaries to have PCOS. Those so-called cysts are really just tiny undeveloped follicles where eggs are supposed to grow. But because of the hormonal chaos, they just stall out. This whole hormonal story really has 3 main characters driving the plot. First, you've got those high levels of androgens we just talked about. Second, there's insulin resistance. This is where your body's cells kind of stop listening to insulin, which makes your body pump out even more of it, which then tells the ovaries to make even more androgens. It's a vicious cycle. And third, there's this backdrop of chronic, low-grade inflammation that just adds fuel to the fire. So all of this hormonal chaos is happening on the inside. But what does that actually look like on the outside? Well, it shows up across a huge spectrum of signs and symptoms, and it can look completely different from one person to the next. Some of the most common signs are really irregular periods, or sometimes no periods at all. Those high androgen levels can also lead to excess hair growth in places like the face and chest. That's a condition called hirsutism. It can also cause stubborn acne that lasts way past the teenage years, and ironically, thinning hair on your head. And because it messes with ovulation, PCOS is one of the biggest causes of infertility. We also have to talk about the really strong link between PCOS and weight. As you can see here, estimates suggest that somewhere between 40 and 80% of people with PCOS also struggle with obesity. That difficulty with weight is often directly tied to the insulin resistance we were just talking about. And then there are some other, more subtle signs to look out for. Things like patches of dark, velvety skin, especially in body folds like your neck or armpits. That's a classic sign of insulin resistance. You might also notice small skin tags popping up. Okay, so with this whole confusing mix of possible symptoms, how on earth do doctors actually pinpoint a diagnosis? Let's walk down the path to getting some real clarity. It usually comes down to a really clear framework that doctors use, often called the 2 out of 3 rule. To get a PCOS diagnosis, you typically need to check at least 2 of these 3 boxes. First, having irregular or absent periods. Second, showing signs of high androgens, either through physical symptoms or a blood test. And third, having ovaries that look polycystic on an ultrasound. So if you go to the doctor, what can you expect? They'll definitely talk through your medical history, do a physical exam to look for signs like acne or excess hair, and they'll probably order blood tests to check your hormone and glucose levels. A pelvic ultrasound might also be part of the workup to get a look at your ovaries and rule out other issues. So once you have that diagnosis, what's next? Well, the entire focus shifts to management. And the best way to think about this is like building a personalized toolkit to tackle your specific symptoms and help you reach your goals. Now, this is so important to hear. There is currently no cure for PCOS. But, and this is a huge but, the condition is highly manageable. That's a really powerful distinction. With the right plan, you can seriously improve your symptoms and lower your long-term health risks. Management really forks into 2 main paths, and it all depends on your immediate goals. If pregnancy isn't on your mind right now, treatment often includes things like hormonal birth control to get your cycles regular and manage symptoms like acne. Medications like metformin can be a game changer for insulin resistance. But if you are trying to get pregnant, the focus shifts entirely to medications that help you ovulate, with IVF being another great option. But here's the thing, no matter which path you're on, the absolute foundation of any management plan is lifestyle. Things like eating nutritious foods, getting regular exercise, and maintaining a healthy weight, they can have a massive, massive impact. In fact, studies show that losing even just 5% of your body weight can dramatically improve symptoms and hormone levels. It's huge. And all of this brings us to the long-term outlook. Because PCOS is a chronic condition, it's really all about understanding how to live well and truly thrive with it for the long haul. Now, it's important to be real about the fact that if PCOS is left unmanaged, it can increase the risk for other serious health problems down the road. We're talking about things like type 2 diabetes, high blood pressure, heart disease, sleep apnea, and even a higher risk of endometrial cancer. And we can't forget the toll it can take on mental health, with much higher rates of depression and anxiety. But, and I need you to hear this loud and clear, you are not destined for these outcomes. This isn't your fate. Taking a proactive approach and consistently managing the condition through both lifestyle and medical support can absolutely significantly reduce these long-term risks. It puts you right back in the driver's seat of your own health. And coping with PCOS means looking at the whole picture. For physical symptoms like hair growth or acne, there are cosmetic treatments and dermatologists who can help. For the emotional weight of it all, therapy and support groups can be life-changing. And for any fertility concerns, the key is to work hand in hand with your healthcare team. For every challenge, there is a strategy. At the end of the day, PCOS is a complex journey, but it is absolutely a manageable one. With more awareness and proactive care, people with PCOS can and do live incredibly healthy, thriving lives. So my question for you is, what's one small step you can take today? Maybe it's to learn more for yourself, or maybe it's to better support someone you know who might be on this path.